Hello everyone, I am Dr. Krishnakumar P, Associate Professor of Cardiology, Government Medical College, Trivandrum. I'm here to talk a few words about cholesterol. In fact, cholesterol is in fact a nightmare for most of us. But cholesterol, I should say, is an essential component of the blood, of the tissues, of the cells of the body, and it is in fact required for the healthy functioning of the body. But too much is, of course, is bad. In fact, you can see that very high cholesterol can be quite harmful for the health of the body. Cholesterol is very important because it is important in uh, making of steroids, important in vitamin D metabolism, and of course important in the bile acid formation. So body actually produces most of the cholesterol it requires, but it also requires cholesterol from the diet. In fact, we get some of the cholesterol from the diet also. So that is what he calls the dietary cholesterol. Now, cholesterol is fatty in nature, and it does not dissolve in blood because blood is watery in nature. So, for the transportation of cholesterol, you require the formation of what you call as lipoproteins. In fact, lipoproteins are nothing but lipids on the inside and proteins on the outside. That is actually for the transportation of cholesterol in the body. Now, these lipoproteins can be of different types. The first and foremost is what you call as the low density lipoprotein, otherwise known as the LDL cholesterol, or in layman's terminology, the bad cholesterol. So, as it carries cholesterol into the tissues, into the blood vessels, most of the time, this is present as the LDL cholesterol. So LDL cholesterol circulates in the blood, and it is a bad cholesterol. It gets deposited in the tissues, and it also gets deposited in the inside of the blood vessels, thus leading to the hardening of the blood vessels, leading to thickening of the blood vessels, leading to stiff blood vessels, and that can ultimately lead to resistance to the flow of blood, which can lead to high blood pressure. In fact, the high blood pressure is a nidus for the formation of what you call as so many diseases, like for example coronary artery disease, stroke, and kidney disease, and so on. The second component is the HDL cholesterol. HDL cholesterol is otherwise the high density cholesterol. It is in fact what you call as the good cholesterol. H stands for healthy. That's what you need to think of now. So HDL cholesterol is when the cholesterol actually most of the time in the tissues and the blood and everything get cleared of the body, it will be present as the HDL cholesterol. So the HDL cholesterol actually helps us to sort of clearance in the body, while LDL cholesterol is sort of get deposited in the body. Now there are different other components also, like for example, you've got IDL, you've got the VLDL, you've got triglycerides. Out of that, I think triglycerides form the third important component of cholesterol. In fact, triglycerides can be formed in the body. It can be taken in the diet also. So what happens is the different type of cholesterols, out of that LDL cholesterol is most important, and the ones the cholesterol get elevated, most of the time you will be asymptomatic, or you'll not have any signs or symptoms of high cholesterol levels in the blood. Now, how you find out whether you're having high cholesterol levels? Your healthcare professional usually will ask you to do a lipid profile. Now, the lipid profile, if you take all the components, you'll be able to find out whether you are having a high cholesterol or not, and whether you are having a good quantity of good cholesterol or not. Now, the different parameters that you'll get in a lipid profile report will be like, first of all, total cholesterol. Total cholesterol is nothing but a combination of LDL cholesterol, HDL cholesterol, and triglycerides. Then you will have a value for LDL cholesterol, then you will have a value for HDL cholesterol, and finally you'll have a value for triglycerides. Now most of these cholesterol levels will be in the form of milligram per deciliter. milligram per deciliter. So that's how you measure cholesterol levels. Now, coming to the total cholesterol, what is a normal cutoff? Like, what number will you be considered quite safe? In fact, if your total cholesterol is less than 200, if your LDL cholesterol is less than 100, your triglycerides is less than 150, and if your HDL cholesterol is more than equal to 60, you are considered as relatively safe, and your cholesterol levels you need in both are about. Now, once you get very high cholesterol levels, your doctor or healthcare professional will ask you, to go for dietary regulation and lifestyle modification. Most of the time, you'll be able to control your cholesterol levels in the initial stages with dietary regulation as well as lifestyle modification, including exercise and so on. But for control of LDL cholesterol, if it is too high with other risk factors like diabetes, hypertension, and all, most of the time you'll have to go for taking drugs. Now, what are the drugs that you take for cholesterol regulation? In fact, there are various types of drugs which we often use for the control of high cholesterol levels. Most important of them all are statin groups of drugs. In fact, statin groups of drugs are considered the first-line drugs management of dyslipidemia or high cholesterol levels. And most of the time, it is supposed to be a very safe drug to take, and in fact, can be used as alone or in combinations as well. Apart from that, you've got bile acid sequestrants, which are also helpful in reducing the LDL cholesterol and can be used along with statins also. Then you have got nicotinic acid, which is actually helpful in reducing your LDL, reducing your triglycerides, and improving your HDL. And then you have got fibric acid derivatives, which are actually very important drugs for control of triglycerides, although it has got some action on LDL as well. Then finally, you've got cholesterol absorption inhibitors, which are drugs which we usually use, to reduce cholesterol levels, sometimes along with that of statins. Now, your doctor has prescribed drugs for you, and of course, you're taking drugs. The important thing to be noted is that you need to take the drug regularly without any break. So if you take drugs irregularly, you'll not have any benefits. Now, along with lifestyle modification and dietary regulation, if you take drugs also, the advantage is that it will be useful in curbing so many other diseases that you can have in the future. And you may need to take only a small dose of a drug if you are sticking on to the lifestyle modification as well. Now, coming to the healthcare tips also, the areas that you concentrate on the healthcare, along with the drugs, the first and foremost is, of course, is a healthy diet. Healthy diet, I repeat. Now, healthy diet means, one's diet has got a very important impact on one's health. And most of the cholesterol, as you know, is produced in the body itself. You need to take cholesterol in the diet itself, in the diet at all, to have a normal level of cholesterol. So you have to go for dietary regulation to regulate the cholesterol levels in your body. And most of the cholesterol in the body comes from, eggs, from dairy products, meat, poultry, seafood, and so on. So you have to concentrate on your diet, and that is by actually reducing the intake of saturated fats. Now, saturated fats, trans fats, tropical oils, added sugars, all these things, lead to increased cholesterol levels. By curbing that, by taking a diet which is actually good in low cholesterol levels, like for example, lean meat, by taking seafood, mainly fish, fat-free milk, whole grains, fruits and vegetables and nuts, you probably are now choosing a healthy diet. Now, you have to limit food with a high saturated fat, like for example, cheese, dairy products, tropical oils and so on, along with meat and so on, you are you are just have to curb that. Now, coming to vegetables and fruits, which is very important, fruits, vegetables, and nuts. If you take your which is important in actually curbing the high cholesterol levels. Apart from that, sodium restriction is also important. Now, the next one that I like to stress upon is, becoming more physically active. Physical activity is very important, and a sedentary lifestyle actually will lead to low HDL cholesterol, and a low HDL cholesterol can lead to, decreased, pouring out of LDL cholesterol, and LDL cholesterol will get elevated, it will get deposited in the blood vessels, and ultimately you will be prone to a lot of coronary vascular disease, stroke, and other renal disease, and so on. So a moderate level exercise, around 150 minutes per week, comprising of brisk walking, cycling, or even swimming, or even dancing, will fit the bill. In fact, exercise is very important in improving your HDL cholesterol and reducing your LDL cholesterol. The third one will be, among all the lifestyle modification factors, will be quitting smoking. Now, smoking actually reduces your HDL cholesterol, and quitting smoking will have other benefits in preventing health hazards like malignancies, coronary artery disease, and so on. Then, of course, losing weight. Overgain of weight will have a very bad impact on your health, will have elevated LDL levels, and in fact, a 10% reduction in your weight will actually reduces remarkably your LDL cholesterol. The fifth one will be limiting alcohol intake. In fact, a very high intake of alcohol is harmful to health. Then the sixth one, of course, is stress. A chronic stress can lead to elevated blood pressure, elevated cholesterol, and if it is not taken properly, in this era, you can have a lot of vascular complications like coronary artery disease, renal dysfunction, stroke, and so on. And finally, experts say adequate sleep is also equally important. It will help to heal and repair your heart and your blood vessels, and it will boost your immune system. In fact, 7 to 9 hours of sleep per day is what is recommended by experts to improve your immune system and to decrease, of course, your cholesterol levels. So finally, summarizing, cholesterol, as I already told in the beginning of my talk, is a nightmare for everyone. But you needn't worry about that. If you have got adequate sleep and other lifestyle modifications, and you deprive yourself of your sedentary lifestyle and start exercising, and if a doctor prescribes take medications in the correct manner, you probably are safe, and you will be able to prevent a lot of diseases like coronary artery disease, stroke, and renal dysfunction, at least in the near future. That's all regarding cholesterol management. Thanks a lot for the patient listening. Thank you.